African-American women suffer the greatest maternal mortality rates in this country, and experts say 80% of pregnancy-related deaths are preventable. Black Maternal Health Week begins today across the nation and right here in Shelby County. To discuss how the health department is working to help patients and local healthcare professionals, we invited Director Dr. Michelle Taylor to join us here on the Red Couch. Good morning, Dr. Taylor.
Good morning, Kanji. It's so good to see you.
It's great to see you too. And I mean, it's such an important cause. What made you want to be part of this discussion?
Well, we know that Black moms in Tennessee have a higher rate of having pregnancy-related complications and death. Black women are 2.5 times more likely in the state of Tennessee to die from pregnancy-related illness. And so we want to make sure that we are celebrating this week and raising awareness of those issues. There are about 81,000 births in the state of Tennessee every year. And in 2021, 134 women died from pregnancy-related causes.
Wow.
Yes.
That is really something. So it is important to take this month and just really just pound that information into people's heads.
Absolutely, absolutely. And so Black Maternal Health Week is always celebrated in April, and April is also Minority Health Month. And so it couldn't be a better time to talk about the fact that most women, whatever race they are, don't understand until they become pregnant that really your health before pregnancy is vitally important. The better health you're in when you become pregnant, the more likely you'll have successful outcomes. And so at the Shelby County Health Department, we're doing a lot of things and have been doing a lot of things to raise awareness, but also make sure that moms and babies have a healthy outcome during pregnancy and after pregnancy.
I mean, you hear it, the name is Black Maternal Health, right? And so you wonder why do you have to single that out?
Right.
Can you talk about the disparities that make it necessary to actually designate it for a specific race?
Well, you know what? There are a lot of disparities. Like I shared before, Black women are 2.5 times more likely in the state of Tennessee to die from pregnancy-related causes. And we also know that inequities in healthcare, whether it be access or just quality health care, and some of the discrimination that Black women face specifically when seeking health care are the reasons why we need to single Black women out during this week and raise awareness, not only for those women who will become pregnant, but for providers who are providing the care, to make sure that they understand that there's always implicit bias in what you're doing, but those are things that can be counteracted, and to make sure that everybody who presents in front of them is getting quality care and has the access to care that they need.
And so when you speak about the discrimination that's happening in doctors' offices, I have heard of and experienced myself where I'm kind of, sharing something that's happening and
Yes.
they kind of look at you like, what are you talking about? I mean, I don't know. And then you just kind of feel like maybe I'm just making too much of it, but then it ends up being something else.
Well, what I always share with people, no matter who they are, but especially women, learn to be an advocate for yourself, right? And so if you have that feeling like you were talking about where you're sharing something but you don't know if they're really understand that a lot of times with providers, it's not intentional. I won't say that that's every
Right.
time, but a lot of times it's not intentional. A lot of times it's just that they don't have the same lived experiences. And so that's when you say, okay, I really don't know if you're understanding what I'm telling you. If you don't, please let me know. Or if you feel like the provider is not going to be receptive to that type of language, go and get a second opinion. It is okay to go to a different provider because your health matters. And if it means that you need to find somebody who you can talk to, you should do that.
And I'm finding that doulas are very prevalent in Memphis and Shelby County.
Absolutely.
And now it's actually part of state law, from what I understand.
Yes.
So there's that.
There's that, and we know from the literature that doulas, or even just having any provider that looks like you and may have similar lived experiences as you as a patient usually means that that patient is going to have better outcomes. And so we all have a role to play in making sure that women have healthy pregnancies. And this week just helps us raise awareness for women who may not understand everything that's going on before they get pregnant, but still want to have a healthy pregnancy and want to live past their baby's first birthday and want their babies to live.
Is there anything specific that the health department's doing that people need to know about, or maybe they could stop by and pick up some literature?
Absolutely. So we have always had a fetal and infant mortality review team that looks at families who may have lost a baby before the first year of life to see what factors may have prevented those deaths. And then of course we have WIC services that we provide, which means that families and babies can get nutritional supplements until the child is age 5. We give out car seats. We give out pack and plays, which makes sure that babies have safe sleep environments. And we're gearing up to do more around maternal health as well.
Wow,
Yes.
so much.
Yes.
Dr. Michelle Taylor, thank you so much for joining us from the health department.
Thank
and
you.
for all the work that you do for us.
Thank you, Kanji.
Resist